for joining us for the 47th Annual AAKP National Patient Meeting. My name is Sharron Rouse, and I'm an AAKP Ambassador for the state of Maryland. I'm also a kidney patient, or as I like to say, kidney warrior. In 2006, I was diagnosed with FSGS. Shocked, confused, and frightened, I vowed on that fateful day that my journey would not be in vain, that I would do whatever possible to manage my condition and to avoid complete kidney failure as much as I could, and help as many people as I could throughout the journey. Through medication, my condition was controlled until 2012, when I began in-center hemodialysis. About a year later, I transitioned to peritoneal dialysis, a type of home therapy, dialysis therapy, which gave me more control over my care and health. On December 2nd, 2013, I received the gift of life from my sister, a living donor kidney transplant. During my years of kidney advocacy work, I was inspired to create my own nonprofit, Kindness for Kidneys International, which is dedicated to educating, encouraging, and empowering kidney warriors and their families. Through Kindness for Kidneys, I work closely with AAKP to provide education and support to individuals within my local community battling kidney diseases. Having experienced various treatment options to help manage my kidney disease, it became apparent just how important it is that we as patients raise our voices and become the leader of our own healthcare team, to demand access to the latest innovations in treatment options and devices that are available, and to ensure true shared decision-making starts with us and ends with us, the patient. This is why I'm so pleased to moderate today's session on how to write an effective comment letter on a CMS proposed rule. Through the AAKP's Center for Patient Engagement and Advocacy and Center for Patient Research and Education, the association is dedicated to engaging and training kidney patients in ways that are most effective at elevating the patient voice and providing practical skills they can implement throughout their kidney journey. And today's session does exactly that. We are honored to have with us Mr. Jack Kalavritinos, founder and principal of JK Strategies. Jack is a public affairs and health communications expert, having spent over 20 years in senior corporate and association leadership, as well as the highest levels of government, including the White House, U.S. Department of Health and Human Services, Department of Labor, and the U.S. Food and Drug Administration. Jack will walk us through how to craft a personalized letter to a planned rulemaking proceeding at the Centers for Medicare and Medicaid Services that can help support better access to new, innovative therapies for all kidney patients. Jack, welcome. I turn it over to you.
Greetings. My name is Jack Kalavritinos, friend of AAKP and founder of JK Strategies, and I'm here to talk to you about how to best make your public policy comment letter shine. Now, before I do that, a couple thoughts about you, about me. First, about you. You know, all of us at our best moments are persuasive, whether it's at work, whether it's with family, whether it's with friends. So before you embark on this, just think about what is personal to you to when you are best at persuading. Are you using facts and figures? What are you best doing when you are closing a sale or you're making the case at work or with family, at church and social organizations? Secondly, I'm talking to you today because I'm someone that has been in the world of government affairs and communications for many years, but importantly, I've spoken to government and tried to make the case for various clients that I've had, but I've also been on the side of the other side of the table, working in government as a senior official in two different administrations and on Capitol Hill. And I've heard and read lots of different pitches. So the thoughts that I'm going to give you today are based on a lot of what I've seen and what I've tried and what I think works best. All right, now, first, Make it unique to you. I mean, that seems obvious, but don't make it so unique that you don't include the AAKP suggested policy points that the team at AKP has given you. But embed them within your own personal kidney patient journey. And based on that, you're going to have an authentic sounding comment letter. You know, one of the worst things that can happen is a comment letter that comes in that looks like a whole bunch of other ones. And you don't want that. Even if embedded in there is a point that one of your AAKP ambassadors also made, that's fine because it's embedded within you telling your personal story. All right, let's go to number 2. The second item is make it timely. Don't wait until the deadline. Now, why do I say that? It's not because I'm worried about you missing the deadline. It's that early on and midway through the process, sometimes mid-level or senior level officials will want to take a glance and not wait until the deadline and see what is it that the public and stakeholders are saying. Well, you know, some adjustments begin to be talked about even before the deadline occurs in some regulatory moments and opportunities. So what you want is you want your comment letter to be one of those that gets talked about, that gets flagged, that gets mentioned. And that's why I say as soon as you see that request for a comment letter, start to think about this and put it together and don't wait until the end. If you do happen to wait for circumstances, that's fine. Just know that the possible impact of it might be less. And now the third item. The third item on the list is make sure that you spend a little time to make it extra relevant to one or more priorities that this agency or the department that this agency is under, what matters to them. Because as someone that was on that side of the table, when someone would make a point of saying, well, we believe in X, Y, and Z, and we believe that this will help the administration's initiative on such and such move forward, that always said to me, look, this is a friendly stakeholder who kind of has our interests at heart and are trying to frame their point of view into what we already care about. So that's why I say, if possible, look for something that might be part of like the broader administration's, point of view on a topic, and then mention that in your comment letter. Now, I'm going to wrap up by saying this. Please don't be skeptical and thinking that these comment letters don't mean much of anything. Look, hopefully we all vote, and we know that there are thousands and millions of votes that are out there. And does one matter vote? Well, sometimes it actually does, but often it's one of thousands and millions. But when it comes to these comment letters, sometimes there are only 20, sometimes 50, okay, maybe 1,000. But when your comment letter comes in, there may be an advocate for your point of view that sees it and takes it and waves it around and says, hey guys, hey folks, take a look at this. This is making the point that we were making earlier in that meeting a month ago. And so just know that there's a decent chance that what you write might come at a moment in time where it pushes them over the line to make the decision that you want them to make. So these are important. Encourage your family members or your friends to also submit them because numbers counts. Your particular one counts, but if you're able to influence 3, 4, 5, 10 more letters, then that's great too. And I have faith that you're going to be able to submit meaningful and personal and effective comment letters to government agencies like CMS and the FDA, and you will be moving forward the values and also the issues that AAKP have prioritized to make your life and the life of your fellow kidney patient and stakeholders and family members improved. So thank you very much.
Thank you, Jack, for an insightful presentation. The information you shared will help us all be better prepared to make the unique and independent voice of the kidney patient heard.